VaMo Radio, and I'm here today with the lovely Dr. Miami. How are you?
Yay!
So, Dr. Miami, there's a lot of people who may not know about you, so you tell us a little bit about yourself?
Sure. My name is Michael. They call me Dr. Miami. I'm a plastic surgeon, and I make people feel better about their bodies. And millions of people watch me Snapchat my surgeries every day on Instagram and TikTok, you name it. So got a large social media following, and I like to talk about plastic surgery and especially cutting edge trends in plastic surgery. And I play cool music, and it's basically what I do.
Awesome. So, Dr. Miami, tell me what made you want to start doing this on social media, showing the world about this?
Right. So, I mean, initially it just started as an Instagram page where I was putting before and after pictures. And then I had one too many nip slips, nipples were showing accidentally. And so they deleted my Instagram account. It was about 5 years ago. And so I was kind of moping around the house, that my Instagram account was deleted. And my daughter said, why don't you try Snapchat? And at the time, I didn't know anything about Snapchat at all, except for that teenagers used it to sext each other. So I was really kind of concerned that my daughter even had Snapchat. But then it turns out that Snapchat had just started that story feature. So I went to the office, and the first patient I had that day was a 19-year-old girl who knew all about Snapchat and was like, yeah, you should Snapchat my surgery so my friends could see it. And she signed a consent form. We did it. And lo and behold, 2,000 people watched it that day. And then we did the next day, and then it was 4,000 and 8,000, and within 6 months we had 1 million people watching. And then TV show and a whole, it was really incredible. But it wasn't part of some grand plan. It was just like we lucked into it.
Oh man, that's awesome. That's really great. So actually tell me, how is the surgery, like the procedure, like how long does it usually take for someone to get the procedure done?
All right, so the answer, it depends what the procedure is. So like a Brazilian butt lift, which is one of my specialties, takes about 4 hours. And a Brazilian butt lift is a great operation. We basically do liposuction, right? We take the fat out of the areas you don't want it, take the fat, isolate it, put antibiotics into it, inject it into the booty, and sculpt it. So you get skinnier in the places where you want to get skinnier,
right,
bigger in the places that you want to get bigger. And it's very, very, very popular. And it's kind of exploded all over the world in popularity. And I was one of the earlier surgeons to do it, starting in the early 2000s. And being in Miami, where everybody wears bikinis all year round and wants big butts, I got a lot of experience with that. And so putting it on social media just expanded that whole thing. So at this point, we're booked out for a long, long time for Brazilian butt lifts. But I also do tummy tucks, breast augmentation, breast lifts, mommy makeovers. And then recently, like literally a week ago, less than a week ago, I did my first penis implant.
Really?
Yeah.
Wow.
Yeah, it's a totally new operation. There's like 5 guys in the world doing it. I'm the first plastic surgeon to do it. There's another 4 urologists that do it, but I'm the first plastic surgeon to do it. So that's very exciting.
That's really cool.
Yeah, so now it's not just men asking women if they're real. You can ask men if they're real.
Yeah. Thank you. Hey, y'all heard that now. We ask the men now. Are you real? Yeah.
Real. Not that it matters, as long as it gets the job done, right?
Exactly. So what has been your best experience with doing the procedure?
Say that again. My best experience?
Yeah, your best experience.
I mean, my best experience. I mean, look, it's fun. It's fun doing plastic surgery. It's what I've always wanted to do. You know, since I was in my late teens. Um, so every day is fun. But like the most gratifying moments are like, like I've had patients say, they're usually moms that have had kids and their bodies just, kind of get bent out of shape from the baby damage. And then after the surgery, they look like their old bodies are back. And I've had, a lot of women say, for the first time in 15 years, I was in the supermarket and I like turned the aisle and I saw some guy look at me like in a way that men haven't looked at me for 15 years. And they just start crying, like it's like such a emotional thing.
Yeah.
And I've had a lot of patients that could never wear bikinis. Like let's say they got pregnant in their teens and they just never had a chance to really enjoy their body. And now they're 30 and they're wearing a bikini for the first time. And they send me pictures and they're like, thank you, Dr. Miami. It's emotional because, I mean, your body and you are very intimate, and it really affects how well and how happy you are with your life for many people. Be able to help them, be their best selves makes me feel good, but obviously makes them feel good too. So, yeah, a lot of good moments, a lot of fun, best moments in my practice over the years.
Now, has there ever been any like bad moments? There's like some little.
No one's ever died. No one's ever died. Thank God. No, but not everything comes out perfectly, and there's risk with every surgery. Bleeding, infection, scarring, hematomas, seromas, blood clots. Things happen, and they do. Thankfully, not that often, but they do. If you do 1,000 surgeries a year, you're going to have at least 25 or 30 complications that you have to deal with, and that's never fun. But if you care and you get patients through it. Thankfully, all the complications I've had have been able to be remedied. Nothing catastrophic. Thank God. But yeah, I mean, there's always risk with surgery, so that's always in the back of my mind.
Of course, yeah. So, I know a lot of people are like a little concerned about the pain afterwards. So, is there ever like a certain treatment plan where like I need this medicine right away or anything?
Yeah, everybody takes it. Everybody tolerates pain differently. Mm-hmm. So, some people like literally 2 days after a Brazilian butt lift, tummy tuck, they're like out on South Beach. And I'm like, what are you, crazy? Like, what do you do? And then some people 2 weeks later still haven't left the room. They're like, oh my God, this is so painful. So it's a spectrum. And most people know themselves how well they handle discomfort. For most people, like a BBL on a scale from 1 to 10 is like a solid 6 or a 7 as far as pain goes for the first 3 or 4 days. And it comes down to like a 4 or a 3 for another week. By 1 month, people are back to normal. But like if you do a combination tummy tuck, breast lift, BBL, I mean, you feel like you got run over by a truck for about 3 days. And then you slowly start to get better. But it's a process. People, I laugh when people say that plastic surgery is taking the easy way out. There's nothing easy about having surgery and getting cut open and sliced and diced, so it's a process. It's not like getting a haircut. It's not like walking into a salon, and then you feel great. No, you have to keep that in mind when you plan this.
Definitely. So like, what has been your best story where someone has said like, this is the reason why I really want this done? Like, what is the best story you've ever heard so far?
I mean, there's a lot. Look, there's a lot. I mean, there's always the revenge stories. Those are great. Those are great. Get revenge on your ex. Stuff that I really can't talk about because it's like a family. I don't want to like get into. But there's a lot of crazy sex stuff that people talk about. That, frankly, too much information for me. But yeah, there's a lot of great stories of why people do it. And like there's gratifying, there's also like a lot of human interest stuff. I had a lady who was shot in the breast and she's had breast pain for a long time. we're able to relieve that. You know, so there's a lot of, you know, heartwarming stuff to, you know, the best are, like I said before, people who just never really had a chance to enjoy their bodies because either maybe they were overweight when they were young or they had babies when they were young, and being able to give them a chance to live again, so to speak, you know, is really, really cool.
That's really nice. That's awesome. So, Dr. Miami, can you tell us where can we stay connected with you, like on social media or anywhere we can find information about you?
So you can connect with me, you know, on all social media at The Real Dr. Miami, TheRealDrMiami, Snapchat, Instagram, Twitter, TikTok, Facebook, or just Google Dr. Miami. I'll come right up, and you just click. If you want an appointment, you can go to drmiamiconnect.com, TRMIAMI Connect.com.
Awesome.
Yeah.
That was awesome. Thank you guys so much for tuning in to VaMo Radio, guys. Again, this has been Dr. Miami. You've got to check this out. Again, if you want to hear this interview, it's on VaMo-radio.com. Also, search Dr. Miami, you guys. Best doctor in the world. Guarantee it.
Thank you. God bless you. Have a great night. I appreciate it. Thank you so much.